The Dental Brief is brought to you by Omni Premier Marketing and the amazing guests who bring wisdom and advice that you can put to use to take your business and practices to the next level. Find us on Facebook and join the conversation. Get ready to grow because we are kicking off the next episode in 3, 2, 1.
Hello, everyone. Welcome to another episode of the Dental Brief. I'm so excited for today's guest, returning guest. I love it when doctors come on the program and share with other doctors and their team members and everyone in the industry. So without further ado, Dr. Martin Mendelson, say hello.
Hello. So glad to be back. It's always an honor to be asked once, but twice, that's even better. I love it. Thank you.
Yeah, no, we're glad to have you here. You're always upbeat, full of spirit, happiness, joy, all of that good stuff, spreading the good cheer. So I appreciate that. For those who didn't hear you on here or don't know who you are, tell us. You're a dentist. You are a dentist, right? You're a practicing dentist.
Yeah.
You had a little hiccup in life happen and threw you on a tailspin. Why don't you tell us about that a little bit?
Sure. Let's see. I've been in dentistry for, believe it or not, 30, 40 years? Because I started at 16 as a dental assistant in practice. Wow. They made me wear white pants. That's a whole nother story. But I went to dental school and had every intention of staying in private practice, became disabled. I had problems with my hand about 10 years in. Was out of work for 17 months in 2003 before the internet is what it is today, and was too experienced for some stuff, too inexperienced for others. You get the idea. After those 17 months, worked in a dental lab for several years as a liaison between the dentist and the lab, worked for Vita in North America, running education across North America. And then 13 years ago came to Spear Education. Today, I'm no longer a full-time employee, having helped build the study club organization and the faculty club organization. I still host our summit, but most of the time what I'm now doing is helping other dentists get out of their own way with themselves and their teams. And I've garnered certifications in executive coaching, team facilitation, emotional intelligence, and yes, happiness studies, which, by the way, the program I completed as a certification program has now been accredited as a full master's. So it's a no joke program that's scientifically based. So that's who I am and what I do.
Yeah, it's fantastic. At the age of 49, I'm really focused on happiness in my life, and it's not because I have ever been a depressed person or had any issues with depression or even sadness for that matter, but I'm seeking a new level of happiness, right? Like actually making it something that's a goal, right? Something that I'm working on and working towards. And it's a really unique way to look at it. When you went through the trauma that you had, and I'm going to call it trauma, not just the injury, medical condition that you had, but I'm sure that scared the heck out of you, right? I mean, my guess, most dentists are not ready for a type of injury that interferes with their careers. Almost very few are, right?
Yeah.
I think you've probably run into that. And my guess is if you're like so many others, that you weren't ready for it either. Were you ready for it?
No, I wasn't ready for it. And thank you for using the word trauma, because through a therapist, I realized years later, that's exactly what it was. And, there was a time where I was, medicating with alcohol and stopped drinking on May 29th of 2015, and which was many years later, if you're doing the math. And happiness is very much a journey, not a destination.
Right.
If you look at the science of happiness, that, many of us, particularly in dentistry, look to goalposts as, oh my gosh, when I do this, I'll be happy. Or when I get to this point, everything will be better. But then what happens is the goalposts keep changing. And so when you start to dive into the science of this, that looking toward that thing, like buying your dream house, there's something called hedonic adaptation. And they've studied lottery winners. And it's like when you finally get that thing, then all of a sudden you start to think, okay, now what? So the focus needs to be on the journey, not the destination. And so I'll give you a perfect example. Mid-March, little old me spoke to Ivoclar for their North American sales meeting. I was the keynoter. The subject was empowering your future using the science of optimism to achieve strategic and personal goals. This stuff is real. And if somebody like Ivoclar is engaging me, and other companies like a subsidiary of United Healthcare had me do the same thing, there is something here about understanding what it is that drives happiness, and being present in your lives is one of the key elements. And what it isn't is toxic positivity. It's not good vibes only. That's the antithesis, because True happiness is understanding that happiness is a comparative emotion, and you can't understand happiness without understanding sadness. And
Mhm.
so being able to navigate through those challenging times is actually what can drive happiness, because you're acknowledging, you're processing, and then you're moving forward and through.
It's almost like I feel a little speechless here. This is something, like I said, that I've been pursuing. So I'm glad that we're talking about this. I think it's really important
Yeah.
to talk about this. I think, I look at now happiness the way that I used to look at leadership, right? That
Mhm.
I used to think I wasn't a good leader. Then I realized, wait a minute, very few people are. It's a skill that you have to develop, and then you
Yeah.
become great at it. Peyton Manning, I saw him at a basketball game the other night,
Oh, yeah.
was not a Hall of Fame quarterback when he was 7 years old, right? It was skills
Yeah.
that he developed. Now, he had some talent, of course, and it was easier for him than others, and all those things exist. It's easier for some people to be happy. But I
Yeah.
believe that now happiness is a skill. I believe that. You think that?
I do. In fact, it's funny you mentioned that because I had an article come out in January in Dental Economics talking about this subject. And I think I coined a phrase called dental dualism. And so dualism is the idea that the body and mind exist as separate entities, which, by the way, was a concept from 1641 by Descartes. I think we've come a long way since then.
Sure.
And so dental dualism in my head is the fallacy that we think that if we can focus on clinical and practice management stuff, we will be successful in practice. No, the body and mind are certainly connected, and focusing on mental health, mental wellness. That's why I've paired up with my good buddy Kyle Stanley, and we're doing our third or fourth Light Side Live course. In fact, it's November 1st and 2nd at Glidewell. Glidewell is hosting us to do this. And so it's a recognition that focusing on this mental health stuff, mental wellness stuff, actually impacts your ability to provide, as we say at Sphere, great dentistry. It's you can't separate the two. And the more you think you can, the more denial you're in that will cause additional challenges, which will not allow you to navigate through and pass them through.
Yeah. I'm speaking at an event in May, and I'm actually this morning, and it's kind of fun that you're on that episode. I'm working on what I'm going to talk about, and happiness is going to come up in there. It's not the focus of what it is, but I'm going to be in a room with 100+ dentists, and it's interesting to think about when we try to achieve something, right? When we have a goal, so many times it's financially connected. I want to retire by this age. I want to buy this thing, or I want to, have this home, or whatever it is. Usually that's what it is.
Sure.
And then once you eat those things, you're kind of like, oh, they own me, not the other way around. They're actually kind of depressing, a lot of these things. So when you hit your goals, happiness doesn't really begin. It actually, I think, can end for a lot of people when they hit those goals.
Yeah.
But when you think about dentistry, and not being a dentist, you're a dentist, so I think I'm glad you're here to talk about this specifically. Room of 100 people, there's only one best dentist in that room as far as dentistry is concerned, right? I mean, at the end of the day, there's one. It's a close call between number one and number two. But if your goal is to be the best dentist, good luck, right? I mean, there's a couple 100,000 dentists in this country alone, right? And you can probably get really, really good. But if you're focused on things like being happy, right? Think about how that changes. Think about how that impacts dentistry, patient health, patient care, what patients think about you, what they tell their friends and family about you, if that becomes a thing. Happiness, right? I mean, it's just such an amazing subject and something to focus on, and such a skill to develop. So jump to your website real quick, martinmendelson.com. I want people to check it out. You've got so much going on. If you're kind of getting this right now and you're hearing it and going, okay, yeah, happiness is a skill. Happiness is something that I need to work on. Where's some places to start? Where do you start working on that?
So I get this question a lot, and I'm a huge book reader, as you can tell from behind me. And so the two books that I would absolutely recommend people start with is The Untethered Soul by Michael Singer and The Happiness Advantage by Sean Accor. By the way, there's a tab on my website, Books I Love, and they're both there. The Untethered Soul by Michael Singer, who, by the way, is a billion-dollar businessman, not some Sherpa guru on the top of a mountain.
Sure.
He talks about, and I'm paraphrasing, you are not the voice in your head, you're the one who hears it. And he talks about your inner roommate and how to combat your inner roommate and realize that the thoughts in your head are not always real. there's research out there that states that we have upwards of 50,000 thoughts per day. 80% are negative and 95% are repetitive. I believe that's the National Science Foundation, if I remember right.
Yeah.
So we all live in this head with our inner roommate, and we listen to this garbage all day, and it guides our actions. One of my hallmark frameworks is an acronym of the word team. Our thoughts drive our emotions that precipitate our actions that manifest our results. Because the truth of the matter is, every single thing that happens in our lives is technically neutral. It's factual in nature. It's our thought that drives the emotion that precipitates the action that creates your own reality or manifest results. So understanding your thoughts is critical. That's the untethered soul. The happiness advantage. Oh my gosh, what an amazing book. There's a TED Talk that he did that's got, I don't know, over 10 million views at this point. I've never read a book that was this entertaining that also had more scientific references than pages. And so he lays out this case for happiness is a journey, not a destination. He talks about the research behind it. He talks about your ability to change your brain. You know, you made a comment earlier that some people are happier than others. Yeah, because certain people have different baselines of happiness than others. And with hedonic adaptation, when you achieve a goal, you're going to be happy for a little while. Then you go back to your baseline. But the beauty, the amazing thing that I finally realized based on science is that the baseline is movable. And so you can change your brain, and it's a stepwise process. It doesn't happen overnight. It happens. You said it yourself. It's a skill, right? So let's give this brain skill as much credence as we do hand skills, and stop this dental dualism, thinking that, oh, you know, this stuff is kind of not as important or should just be there or not there. No, it's a skill. It takes time.
Yeah. You know what you're talking about, and like the meaning that you give to these things that actually happen to us. I want to just kind of put that in perspective. If you were to win the lottery last night, and this morning you went and picked up the check for $1 billion, and then you stopped by the Ferrari dealership or whatever it is and bought your dream $1 million car, and you were driving that car home, and a rock flew up and hit the windshield and cracked the windshield, it would for most people, that would be what they thought about. What horrible thing happened to them that day, right? This rock chipped a windshield.
Yeah.
They got $999 million left to buy another windshield, right? But they wouldn't be focused in on that. And you do that. So many amazing things happen to us every single day. So many amazing interactions. One negative thing, and that's what we focus in on. That's what we think about all day long. How do you stop that?
So it's funny you mentioned that, because I was just talking to one of my dentist private coaching clients this week, and he was going through a challenging day with a couple different things that happened. I think it was 3 total. And I stopped and I said, let me ask you a question. How many patients did you interact with that day? Not just in your chair, but in hygiene. And I think the number was 17. I said, okay. So we're making a choice. I'm not judging, but we're making a choice that we're going to focus on those 3 challenging interactions versus the 14 others. Why are those 3 more important than the 14 others?
Yeah.
And he looked and he stopped and he goes, I don't know. I guess it's just what I've done all these years. I said, great. Thank you for your acknowledgement. What do you think about that? He goes, I don't know why I do that. I said, well, what would it be like for you to consider that we're going to start focusing on the 14, not the 3. And oh, by the way, at the end of the day, when we leave, we're going to make a habit. I'm talking at actually a California Dental Association in May about habits. We're going to make a habit that we're going to look back at our schedule and we're going to pick out 3 things that we are thankful for or good that happened that day, so that that's our focus versus the 3.
Right.
And so this is a common thing that all dentists, all professionals do, that really take pride in what it is they do, because when things don't go so well, it hurts, and that's okay.
Yeah.
But we have a choice of what we focus on.
It's a skill. And even though I don't always practice what I preach, I try to. I fall short like everybody, but I think having a gratitude journal, and I know that seems ridiculous to some, but do it. Write down, take a minute a day and write 5 things that you were thankful for. And what I think about gratitude might be a little different. I think about gratitude as things that happened for me. So not things that I did. I'm not grateful that I was able to do this today, or not grateful that, I worked and I got this thing or hit this goal or whatever. It's
Sure.
like
Sure.
things that happened to me that like I had nothing to do with. They just literally happened to me. And it's amazing how that will change you, right? It's amazing how better you will sleep at night when you just go to bed thinking about the things that, you're blessed with, right? That you had nothing to
Absolutely.
do with whatsoever. So
Absolutely.
yeah,
And it's whatever it is for you, because even writing down that you're grateful that your coffee tasted extra good today is still valid.
yeah,
And so I just this is so bizarre. I just posted on LinkedIn this week a picture of my journal that's by my bedside. And right before bed, or as I get into bed, versus getting on my phone, I sit down, I write down 3 things a day I'm grateful
yeah,
for. And you hit the nail on the head. Like, some people think this is fluff. There's research behind this. Seligman did this with diagnosed depressed patients, split them in two. Half the group went on their way, taking their meds and doing their thing. Half the group wrote down 3 things they were grateful for 7 days and stopped.
right,
At 1, 3, and 6 month intervals, they reported greater levels of happiness, lower levels of depression. Why? Neuroplasticity, changing your baseline, focusing on something
yeah,
different. When you focus on something different, that's what you see. It's like you talked about if you won the lottery and bought a Ferrari. Well, maybe Ferrari's not the best choice, but for most of us, we're not driving Ferraris. When we buy a new car, we start driving around town, we start to see the same or similar make and
all
model
the
that's
time. Yeah, nobody
everywhere.
had it before you did.
It's a Bader-Meinhof phenomenon. It's frequency
Yeah,
bias. Whatever you focus on is what you will
right.
see. Period. End of
Yeah.
story.
We're getting close on time here. I want to jump
Yeah.
back to 2015 with you. You said you stopped drinking in
Yeah.
2015. I don't know if you used the program or not. I am grateful that I've never become addicted to alcohol, even though I know so many people that have. I've been fortunate in that sense. But a long time ago, through some personal growth, somebody recommended that I read the 12 steps. And that I read,
Mm-hmm.
I think it's called the Big Book or the Blue Book or
Mm-hmm.
whatever. It's the Big
Mm-hmm.
Book. I think it's
Yeah.
called the Blue Book. And anyways, so I read it, and it was fascinating to think about these kind of steps and transforming one's lives. And it was fascinating to read about the history of AA, and that
Mm-hmm.
until Bill W., like doctors literally
Mm-hmm.
thought that the only way you could cure alcoholism would be to put people in asylums, to lock them up
Yep.
like they were werewolves,
Yep.
right? During a
Yep.
full moon.
Yep.
And that's what they thought.
Yep.
But what they actually realized is that people could change their brain. And one of the things that they did was get outside of themselves, right? Which I think is in the first, I
Mm-hmm.
don't remember the steps, but I think one of those first couple of steps is to realize you can't do it on your own. You need help, right? You need
Correct.
to build
Correct.
skills. You need people to help
Correct.
you, right? And that's
Correct.
so many of us hold on to this weird thing that I got to do it on my own, and help is weakness and all that stuff. It's ridiculous. But think about that, overcoming alcoholism, something that doctors said was impossible, right? Just some help will be a big
Mm-hmm.
part of that, right? But then later on,
Yeah.
and I don't remember again the step, it might be the last step, it's helping other people, right? So it's
Mm-hmm.
literally mentoring other people and helping
Yep.
other people with
Yep.
this, right? There's a huge importance to that. And I'm sure that's part of why you do what you do. You're getting something out of this
Oh,
by helping
100%.
other people on their journeys. And it's a fact. If somebody tells you something, you'll retain, I think it's like 10%. If you write it down, it's like 20%. If you teach it to somebody else, it's like 80%, right? So that
Yep.
it'll remember
Yep.
and stick with it. So I encourage people that are listening to some of those things that you know right now, some of the things you've already maybe mastered or are close to mastered, start helping other people with it. And it's happiness. Start helping people with that too, because we have an epidemic in this country. It's not a pandemic. It's not all over the
Oh,
world. There's
absolutely.
people that are really, really important, really, really happy. Right? It's an
Mm-hmm.
epidemic in this country of sadness, of depression in our youth. Right? It's overwhelming in the 30 and under. The depression levels in
Yep.
20-year-olds is through the
Yep.
roof. And I know we want to pick on them, but these are the people that are carrying us forward, right? And for a lot of you, they're going to be carrying you forward, and your lives are going to depend on them
Yep.
taking care of you at some point. So I just wanted to say that, Dr. Mendelson, I want you to comment on that and kind of have the last word here.
Yeah, no, it's everything is a journey, and a journey starts with a single step. And of the 12 steps, or of overcoming anything, the first step is recognition that you have a problem. And so that's a huge step forward. I dabbled, I've read the big book, I've gone through most of the steps. It's not something that really resonated for
Sure.
me as much. However, I found other avenues. I found other mentors. I found other accountability partners to help me through my own journey. But you're right. It's understanding that we're human. It's understanding that nothing like this ever ends. Like happiness is a constant journey. Overcoming addiction is a constant journey. And so it requires constant oversight. And this dualism of thought, again, 1641, Rene Descartes said that the body and mind are separate entities. And so many people still think that. It blows my mind. And so this is something that if it's important to us and we want to work on it, we can overcome. And, you know, the one thing I talk with a lot of my clients and a lot of the teams is this idea of success amnesia. Like we go through the motions and we do things and we gain successes and then we negate those and we forget about them and we move on. And we can't just celebrate, you know, graduating from dental school. I'll use a universal example. What about celebrating all the millions of mini steps that took us to get there?
Right.
So are we really celebrating the graduation, or are we celebrating the journey? Because there's a big damn difference between the two, because it'll set you up for success in a very different way.
Yeah, makes sense to me. And I want to, so much to think about here. You know, it's great. I'm so glad you're here. I want to encourage listeners, check out Martin Mendelson, Mendelson.com. I know you do a lot of big speaking events, but that's not all you do. You do personalized coaching too. So check that out. I want people to do that. Reach out. And he's the guy that's going to respond and get back to people. So Dr. Mendelson, thank you so much for being here today. We appreciate it.
Thanks for having me. I appreciate it.